On the Medical Watch, since the start of the pandemic, fewer children are getting their regular vaccinations.
Yeah, the CDC says in the fall of 2019, about 96% of kids in public schools were adequately vaccinated. 96%. However, that number dropped to 88% last fall. So joining us now to talk about that decline is Dr. Rosabel Arcia-Diaz. She's a pediatrician with Cook County Health. Doctor, thanks for checking in on this important topic today. How are you?
Hi, I'm good, and you?
Good, good. So we want to put the focus here. This started last spring. Right now, parents are bringing their kids back to the doctor. Are we going to get to where we need to be? What is your concern heading down the road here?
Yeah, so our concern right now is that many kids are delayed in their immunizations. They have missed some appointments, so we really encourage all parents to come back as soon as possible to reschedule appointments with their pediatricians.
So I know that at the start of the pandemic and certainly halfway through it, we talked about this, how many parents were not taking their kids to the pediatrician. They weren't getting their vaccines. And so I'm wondering, do you think we can catch up in time right now to avoid any serious illnesses and other viruses that may pop up?
Yeah, there's a possibility we can catch up on time for many children. It depends on how many immunizations they have been missing, but we follow strict guidelines through CDC, and we can catch them up as much as we can before they start school. So it's very important they start coming back as soon as possible to their medical homes.
Okay, so let me ask you real quick, what are some of the vaccines that you're seeing the biggest delays with?
We're seeing a lot of delays, both on the childhood immunizations, like the immunizations, for example, measles immunizations. We have seen a decline on that, so that's a big risk, any outbreak on measles. Same with vaccines like the whooping cough, for example. So we really want to get those immunized as soon as possible.
DTaP, really, another one. Doctor, what is your thought about how this will impact kids when they have to go back to school in the fall? And many of these illnesses are more virulent than COVID-19.
Yeah, that's correct. That's a big risk. Many of these diseases are transmittable like very easily. So the concern is like, can there be spreads between children that are behind on their immunizations, and can there be any outbreaks? So we really want to like get them back into the pediatrician's offices.
Okay, thank you so much, Dr. Rosabel Arcia-Diaz, pediatrician with Cook County Health. We definitely appreciate your time.
Yeah, thank you.
We'll talk again soon.
Be well.